Turn to Africa. For many indigenous living in the Republic of Congo, regular health services are almost non-existent. Thanks, however, to doctors from Medicine DAfrique and missionaries from the Catholic Church, some remote indigenous communities are receiving aid that could save their lives. There's cause for celebration for this small indigenous community living along the banks of the Bangui River in a remote part of northern Congo. A mobile team of health workers has arrived to vaccinate villagers, treat diseases, and provide advice on hygiene. Doctors from Medicine DAfrique, along with missionaries from the Catholic Church, have traveled 5 hours by motorboat to Moscow, a small village on the fringe of the forest. For many indigenous living in the Republic of Congo, regular health services are particularly non-existent. Mortality rates are high, and malaria, measles, and tropical skin diseases are common. For 10-year-old Albert, the pain of Sister Angelia's jab of penicillin will soon be forgotten.
This work is very, very important to them because when you neglect them and leave them, many of them will die. Some of them that are suffering from this sickness, after giving them this injection, when you come back 2 days or 3 days, you see that the wound is now going gradually until you will not see any wound again.
The challenge in many remote communities is lack of health facilities. Even those that do have access to treatment struggle. Discrimination against Congo's indigenous people is deeply entrenched. They are perceived by many as subhuman and as merely a source of cheap labor. It is no easy task for parents who often have scant details on when and where their child was born. Parents often have to resort to examining teeth to approximate the age. The mobile health clinic, along with the birth registration, is part of the larger national plan approved by the government and supported by the United Nations International Children's Fund and its partners to help overcome the marginalization that these indigenous communities still face. TITV Weekly.